guess I can go again. So I'm accepted to a couple of different places. I'm in at SIU, University of Illinois, University of Indiana, SLU, Rosalind Franklin, and then I'm sitting on the wait list at a couple of others. As for like intended career, I hope to work in a rural area somewhere, and I've also got like an interest in being part of like an ethics board. So, and then I guess as far as specialties, emergency medicine, peds, psychiatry. I mean, it's still pretty early, so I'm not sure quite what I'm doing, but I guess that's where I'm at right now.
Yeah, so I'm at University of Illinois in Rockford. I'm in my first year, and like I said earlier, I'm interested in pediatrics, but I'm also just really open because I don't think I'll like know for sure until we go through our like rotations. But I think cardiology is cool, dermatology, pretty much everything we've learned about so far is pretty cool. But yeah.
Yeah, I agree. Like, we're only like 6 months into school, and everything's so fascinating. It's hard to really decide on something so soon because we really haven't even been seeing patients or anything really. So I don't know. Keeping an open mind with everything is pretty. That's how I'm going about with it.
Yeah, kind of the same. Being a first year, you get exposed to a lot of different stuff, so it's pretty hard to make any kind of decision unless you're coming in with an idea of something that you really want to do. Like I said before, I'm at University of Louisville, and I'm interested primarily in internal medicine right now, in the subspecialties associated with that, which is like cardiology, gastroenterology, hematology, oncology, a bunch of different stuff like that. A lot of ologies, but for right now, pretty open. And I think that's a good thing for your first year because you learn so much stuff.
Cool. First question in, and I'm already fangirling. Let's see. How did you decide on that career specialty, and like essentially, what made you like want to become a doctor?
That's kind of, I don't know, that's a little bit of a tough question because I don't know that there's ever really like one strong defining moment for a lot of people. I've kind of always I've been interested in it as a career ever since I was like a little kid. I had lots of family in healthcare. And I think I was kind of drawn to like the leadership role. And then I guess as I got older, I came to appreciate the value of having like that top tier of education. As far as if I'm going to be taking care of people, I think I would like to be as highly educated as I could be. So.
Yeah, I would say I didn't really have like one specific like turning point. I was always interested in healthcare. My older sister, she's a physician, so seeing her go through medical school and all the kind of like amazing things she was able to do kind of inspired me to pursue a career in medicine. Just a side note, this is also a really good question for all of you to be thinking about because I feel like on all of my interviews, they ask me this question, so.
Yeah, it's definitely a tough question, and one that it's very important to definitely know what your motivations are. Yeah, for me, it was I didn't have anybody in healthcare that I was around in my family, so I'm just a pretty new person. I didn't really know what the path was like, but definitely what inspired me was just trying to see how much I could make a difference in a career path in my life. And I thought like healthcare was one field that definitely could impact a lot of people. And then pursuing that route made me decide more on being a physician, just getting that clinical experience and seeing what doctors and stuff do. So, yeah.
Yeah, I can echo a lot of what the other panelists have said. Kind of growing up like Jake, I don't have anybody in my family in healthcare. So I was pretty new to the path as well. So I didn't really know what to expect. But one of the biggest defining moments for me was just growing up in communities without much healthcare. And so being exposed to that at an early age or being exposed to the lack of healthcare, I guess, at an early age. But then, like everybody else has kind of been saying, when it comes to taking care of patients, being a physician it provides the most space and the most ability to actually practice the education that you receive. And it allows for a lot of autonomy. And in my opinion, that's the best way to take care of your patients, is when you have the autonomy to actually utilize the things you've learned.
Wow, that was good. All four of you. Whew. How did you decide on your particular program? What were your main considerations when making that decision?
Well, I have not yet decided on a program, so I can't really speak to that with any certainty. But as I'm kind of choosing between them right now, I'd say my main considerations are I mean, a lot of it does have to do with like the cost of attendance and price, and am I going to be able to get scholarships or not? And then I would say the other like two really important things are like the residency match list and just like making sure that people are able to match into specialties that I'm interested in at the programs. And then also the location. For me, I think it's nice to be relatively close to home. So that kind of influenced where I applied and will probably influence where I end up going. So.
Yeah, like I said earlier, my older sister actually went to UI-Com in Rockford, so that was a big one for me. But comparing that to other schools, honestly, I felt like it came down to how the interview day went and how like I felt, how like the students treated me, the faculty treated me when I was interviewing there and touring there and stuff. Also, I would look at like how they do their curriculum, because some schools are more really heavily focused on like team-based learning. And I'm more like of an individual learner, I would say. So that was kind of like a turnoff for me for some schools. And then I would say location for sure, just because I wanted to be close to like UI-Com has 3 locations. And I wanted to be in Rockford because my significant other's in Wisconsin. So that was a good option for me. Also, some like schools offer certain programs, like if you're interested in rural medicine or like urban medicine. So that can also determine like what campus you go to, or what school you can go to as well, if you're interested in those sort of things.
Yeah, I mean, I could probably repeat everything that Abby had to say. Definitely just the vibe I had when interviewing at a specific, well, really the school I'm attending in Peoria, University of Illinois. I just really fell in love with the place. I thought everybody, it's a smaller campus. It's like 65, there's only 65 students per class. And so I just felt like, because SIUE was it's a pretty close knit, tight community. I felt like I would really enjoy it there, and that's ultimately it was more of a place where making that decision was one based on where I felt like I could succeed and have the most success in the future with regards to just learning and I was pretty close to home too, and then yeah, my significant other lives in Peoria as well, so a lot of different factors, but definitely a big decision to make as well if you have that option to choose between different schools.
Yeah, I would say that location was the biggest factor for me. I didn't apply anywhere that wasn't a state that touched Illinois, and that was just a personal choice. I mean, because you have to, at the end of the day, I mean, you're going to be living there for 4 years. And so you want it to be places that you could actually see yourself living. And for me, I chose Louisville because my mom's family's from Louisville. So I'm here a lot. So it's kind of like a second home. And that was one of my big reasons for picking here. And another reason was kind of just the diversity of it, the patient population that you can see in your clinical experience. And so being in an urban area at like a big academic medical center, we see a bunch of different kinds of patients. and we're able to rotate through a bunch of different specialties here in-house. And so that was one of the later factors in helping me decide between schools. But I'd say, I mean, at the root of it, location was the biggest thing, because I mean, you're going to get a great education at any school in the United States. And so don't let rankings hang you up too much. Pick places that you really can see yourself going and where you mesh with the students and the faculty that you meet on interview day.
I'd also like to add, the program I'm at is an MD program. And I know there's two paths you could really take: DO, Doctor of Osteopathic Medicine, and Doctor of Allopathic Medicine, MD. And so I don't know about everybody else besides Andrew. I'm not sure what program you applied to, DO, MD, but I think everybody here applied MD. That's just another option. I don't have really any experience with applying DO or anything, but it's definitely, if that's what your experiences are in, like a DO, then go for it, I guess. But there's just different pathways out there.
All right, cool. Kind of straying away from the script a bit, but keeping on topic of this, are any of you guys like considering any like dual degrees, MAMD, MAPD, PDF, MA PhD, stuff like that? MD PhD, sorry.
I say a couple of the schools that I'm applying at have the option where you could pursue like a master's in business or a master's in like ethics or something. If I were to go to one of those schools, I think the master's in ethics is especially interesting to me, just as it's super interesting to me as like a field of study. But I don't know, again, it depends a lot on where I end up going. So
Yeah, a lot of schools have additional degrees you can get. Like I think most schools have an MD, PhD, but I think a lot of people do that if they're more interested in like academic medicine or doing a lot more research, which I'm not interested in, so I don't want to do that. But that's definitely an option at most schools if you are really interested in doing a lot of research. You don't have to do that to do research though.
And I will say that with PhD programs, it's usually MD PhD, not a DO PhD. So MD schools are usually the ones with the combined PhD programs.
All
There's
right.
also MD MBA programs. You can get a master's in business administration as well. I know University of Illinois has that, but I think it's Chicago campus only or something like that.
All righty, cool.
Oh,
Yes,
one more thing to add, sorry. All of this, like the dual program stuff, it can be found on the school's websites. Like if you were to look up such and such medical school, you can see their dual programs.
And I think you don't really have to make a decision on that either until like after you're accepted as well. So that's another thing to consider.
all right. Thank you for the thumbs up, Grant. Yeah, I mean, I remember last year being a very like medic mindset of just doing whatever school takes me, but like doing some more research on schools right now. I'm really focusing more on like what interests me as a human being and stuff like that. So thank you guys. I learned that from y'all. So the next question is that I should probably get to right now is okay. Kind of straying away from the program, but more so SIUE is, tell us a bit about what you studied at SIUE and how you feel they prepared you for your current studies. What was the most helpful class you took while at SIUE?
yeah, okay. So I've been a biology major for the majority of my time here, and I feel like it's done a pretty good job of preparing me for medical school in the sense that I've got like a fairly strong background in science that I can approach a lot of the like presumably can approach the earlier on coursework with. And then I guess as far as helpful classes, like for direct like success on the MCAT, I would say that cell biology was, I mean, that was probably the most helpful thing. It showed like how important it is to like the human condition. It got you better at studying and memorizing and critically thinking. And then on the MCAT, there's so much carryover with all the different like molecular techniques anymore that I would say that it would be very difficult to take take the MCAT without having taken some sort of cell biology. And then I guess the most helpful in regards to like applying would probably have been like a medical ethics, or I took an honors class that was pain and suffering. Was the title of the class or whatever. But I think both of those did a really good job of kind of showing like the soft side of medicine, because so much of healthcare is really sociology and understanding how humans experiencing things translates to patient care. I feel like those have helped me write much better essays as I was applying and kind of exposed me to different kinds of thinking.
So I don't really remember all that much like what helped me for the MCAT, but for medical school, just because that's like obviously super fresh, biochem was like, we hit biochem so hard our first block. So I took biochem with Dr. Norcio, which he's the hardest one, I think, but he was so good. Like I felt so prepared going into those classes, because he makes you memorize like everything, and you don't have to memorize everything in medical school. You just have to memorize like the important stuff. So that was super helpful. But again, like when you're choosing classes, it all depends on who you take it with. So you can take it with easier professors, but you won't get as much out of it. So I would definitely recommend taking, those harder professors that it may like take a lot more work, but that's going to pay off in the end when, you already know that stuff when you get to medical school. So I would say biochem with Dr. Norcio and physiology with Dr. Williams. Because I know, Jake, we're hitting physiology pretty hard right now with cardio. So I thought he was super, super helpful when coming to that stuff. So those, I think, are the two classes that have helped me the most.
Yeah, I'd say Telemelect was I'd say that was the most helpful just for preparing for the MCAT purposes. Not so much now in medical school. I don't really see it as helpful because we don't really dive deep into the cell biology of things, but definitely for the MCAT I thought was helpful. Like I said, I was a biology major, so I had a pretty extensive background in biology and stuff. So although you don't really have to major in science to apply to medical school, you can major in really whatever. And honestly, that's something I would recommend. If you really have a passion for, say, sociology or psychology, choose that, because college is one place in your life that you're not going to be able to go back and really relearn that when you're a doctor. You can, but it just makes more sense, I think, doing college. Like I said, I don't know what other classes. Yeah, maybe like physiology was helpful. Anatomy, I took that senior year. Anatomy was super helpful for this past block. Just having that in the back of your mind, like understanding what nerves go to what muscle and all the different bones and stuff is pretty helpful, I think, but not required for medical school.
Okay. Well, I think I'm the only one here that was not a biology major. I majored in exercise physiology, or exercise science, sorry, is what it's called. But I minored in biology and chemistry. And I would say that my degree program, I kind of tailored it to where I was taking all the classes that I really wanted to. And I was able to basically take all the classes that were needed for the MCAT or for medical school with that degree program. But I would say the most helpful classes so far have been definitely biochem, more so this semester, and then anatomy and physiology, which in medical school here, our first semester was anatomy. And so everything has basically been a review at this point. So I guess I covered all my bases up until now. But those are the two that I can think of.
Alrighty, thank you guys. We also have another panelist here, Kayla, aka Mom. Would you like to introduce yourself?
What'd you say, Justin?
I said hi, Kayla.
Oh, hi. Hi, everybody. Do you want me to just like go on?
You introduce yourself, Kayla. Thanks.
Okay, great. Yeah. Sorry, I was a little late, I guess. But anyway, I'm Kayla. I used to be Nichols, now Swisher. No, I did not get married. But anyway, so if that confuses you with the name thing. But I majored in biology and psychology with minors in criminal justice and chemistry. But I think the most useful classes, me and Jake had human functional anatomy together, and that was extremely useful for classes. I think so. I kind of have a weird story. I took a gap year, but I did a program at SIUE, which is called the Medical Anatomy and Physiology program. I did it for 1 semester. I got admitted into medical school, so it's not a degree granting program. So I wasn't going to waste the extra $16,000 for the second semester because their goal is to get you into medical school. But for the first class semester of that program, it's only a 1-year program. You take 3 out of the 5 first-year medical student classes at SLU. So it was actually technically in their medical school. And anatomy was honestly the most important one that I took, and it was so useful in all of the classes. So that one for sure. I liked, Grant said he kind of had a different major. I did typical biology, but then the psychology was just something that I really loved. So I decided to do that. And I think that was really nice that I got kind of something that I got to study that I enjoyed as well. So that's it. That's my story.
Love it, Kayla. Yeah, I mean, we got a lot of pre-meds here who don't do like traditional bio, and that's something that's really cool. Something I wish I did more of too. But yes. So another question we have is, did any of you change your major while at SIUE? Can you explain to the students the thought process behind that and how you made that decision?
Yeah, so I can go. Sorry, Andrew, I cut you off first this time.
Go for it.
Yeah, so I was actually nursing until my second semester sophomore year, and then I switched to pre-med. I'd always I wanted to be in the healthcare field, and I was always between like medical school or like becoming a nurse practitioner. But so for nursing, you take basically kind of like intro bio, intro chemistry classes, and then you kind of move on. What I discovered was that I really liked those bio and chem classes, and I wanted to do a lot more of that instead of just move on. And kind of like what Andrew was saying earlier, I kind of wanted to be like have as much knowledge as I could about those things. Like I'm the type of person where I like to like know what I like everything that I can. So I thought, becoming a physician, I would have a lot more education and whatnot under my belt rather than, a nurse practitioner. So yeah, I made the switch my sophomore year. Which kind of like, it was nice. I graduated on time, but I graduated in 4 years, but I had to take a lot of classes in the summer and stuff. And I didn't get to take like some of the classes I would have liked to take. Like I wanted to take some Spanish classes, some like immunology, just some of those electives like psychology that I would have liked to take, but I just couldn't fit in because I was trying to shove everything pre-med into those like 2.5 years or whatever. But yeah, I made the decision one day over Christmas break, and then I never looked back, and I'm really glad that I didn't, and I ended up here today. So if you have any questions about that, let me know.
Yeah, I had a pretty, I guess that's fine. I'm glad you went first because you said pretty much everything that I was going to say about it. I started out as a nursing major as well, and had my coming to God moment on like the second day of class where I was like, wait a minute, I think I want to be a doctor. So I shuffled around and like changed my entire schedule. And aside from having like a crappy freshman year schedule, overall, I'd say I got out pretty well and got to take most of the classes that I would have liked to. No shame in changing your major at all. And yeah, I mean, I'm sure you could find, I mean, I'm sure you could be just as successful applying to medical school as like a nursing major who took all of the classes, but I just felt the biology background might be helpful for me personally. So.
Yeah, I think you could apply to medical school with any major, but it is helpful to at least have some like biology just to get you through the MCAT, I would say. And it's hard if you're a different major to fit all of those classes like anatomy, cell, biochem, orgo, all that stuff in addition to your other major. But it can be done, but it is a lot of extra work.
All right, cool. I didn't expect that question to get so deep and emotional, but I felt something there. Thank you, Abby and Andrew. Grant DM'd me, said he was crying, and I'm also crying too. Anyways, the next one is there anything different that you wish you had studied at SIUE, like a subject or class you wish you had covered?
I see. Yeah, overall, I don't have any major regrets. Like as a biology major, I feel like it suited me pretty well and let me explore a bunch of things that I found very interesting. And I think it prepared me pretty well. But like I've heard, I mean, several of you guys have said that like you'll learn most of the biology that you need to know in medical school. So part of me does almost wonder if, I mean, maybe like a more fun like major, like I mean, I guess exploring something that I personally found interesting, like I mean, philosophy or journalism or sociology or I guess I would encourage you all, it gets very easy to like hone in and think about what classes are going to best prepare you for medical school, but it'll be your last opportunity to really learn about some of these things. So maybe try branching out and taking one of those classes that you may not have an opportunity to otherwise.
Kind of piggyback off of that, I think my psychology major obviously helped with the psychology part of the MCAT, but I really wish I would have taken a sociology class because I felt like when I was studying that part of the MCAT, that was brand new terminology for me. So I had to spend a lot of time learning just the terminology before I could even work on like actually memorizing the material. So that's kind of is my one regret I got basically all my bases covered except for that's my dog. So sorry, everyone. But yeah, I got all my bases covered except for the sociology.
Okay. If I could, so like I said, I majored in exercise science. I minored in biology was one of my minors. If I could go back just personally, I think I would have double majored just because I did enjoy both aspects of my curriculum, and that would have been more work, but I think that's something I would have liked to take advantage of. But like what everybody said before, when you're in college, remember you're in college. Take what you want to take. If there's things that interest you, just do it. I mean, because it's not like it's going to hurt you at all to take a philosophy class if that's what you want, or a journalism class or anything like that. I would say just use college as an experience, not as like just a stepping stone for medical school. Enjoy college while you're in college, because you aren't going to get to say, or you're not going to get to take those classes once you're actually in med school. And you're going to learn everything you need for your career while you're in med school. They basically treat it like you're at square one. It's not like they expect you to come in with like 100% knowledge anyway.
All right, cool. Okay. What is one piece of advice you would give to students approaching the admissions application? What's something you wish you had known?
Oh, my advice would just to do it all early, because that's something I did not do, and I don't regret it, but get all your applications in early, take your MCAT on time, get everything in, by, secondaries, maybe like August or September. get it in as early as you can. And I think that gives everyone their best chance at getting in where they want to. Oh, and your letters, because I was waiting for forever from a letter from one of our fantastic faculty. So get your letters in early too. So just get all that done, and then you don't have to worry about it, and you can focus on your interviews.
I am going to once again echo everything she said. That was like the one big thing that I had written down. It is so important. I don't know. I mean, apparently it was important even years ago, but this year especially, they had so many applications. I applied like very early on the first day, and it took them, I think, almost 3 weeks to verify my application. My friend with better scores, like he got a slightly better MCAT score than me, and really good. I mean, he just had a much rougher cycle because he submitted 2 days after me, and it took him almost 8 weeks to get verified. So it is like of the utmost importance to get your stuff in really early. And if that means like pre-writing or preparing or having everything ready to go day one, I don't know, it's just become more and more important. So definitely would reiterate everything that Abby said. So
ask for feedback is something that's pretty important. So asking for feedback on your essays. Don't be afraid to reach out. I use my mom to help proofread stuff and make sure it sounded, that I wasn't talking out of my ass or anything. Ask for help on, ask for letters early. That's already been said. But yeah, reach out to other people. I mean, you're already here listening to us go on about, our lovely life in medical school. So you're already taking the first step. So yeah, just ask for advice.
Biggest thing I could say is apply early. Like apply as early as you possibly can, because that is the easiest way to shoot yourself in the foot before applying. Because schools can't admit you or give you an interview if they don't have your application. The application for MD schools opens up in the beginning of May, so you can be working on it and submit it. And regardless of if your score is in, you can still submit it to be verified, or in the line to be verified. And then once they have your score and everything, they can actually send it out to schools. So make sure you apply early, and do your research ahead of time. And also, yeah, like Jake said, ask for feedback on all of your essays and stuff. Don't be afraid to take constructive criticism, because it's better to have more passes. And also, then once you get done with your interviews, handwritten notes to your interviewers, it's just a really nice thing to do, and it helps, honestly.
I think also another thing is to know where you're applying, like actually do research on the programs, because a lot of people, they'll kind of blindly apply to all of these programs because they think they have a higher chance because, they applied to more. My dog making noise again. Sorry, everyone. But anyway, I found like a lot of people like I would talk to, I'd be like, oh, did you like that program? And they would have no idea what I'm talking about. And sometimes that's even pops up as an interview question. And you kind of can shoot yourself in your foot that way if you have no research on the school and you're not prepared for that. Also making sure when you do the research of the school, you'll have questions about certain programs. And you can bring that up at the end of the interview. And that kind of gives you some bonus points too, because they know that you actually paid attention to how their school works and their curriculum and everything. So.
Well, and who I'm emailing on May 1st, so thanks guys. Let's see, what's the next one? Do you feel like any aspect of your application sets you apart from other applicants? Please explain.
Oh yeah. So I'm just going based off of what like my interviewers asked, like what was commonly asked, because they like have your application in front of you and they like look at things. So a lot of them asked about like why I switched from nursing, because that was something that like not everyone has done. Also, I was an SI leader for a few years, and then so they asked about that, and I did some like tutoring at a tutoring center in Edwardsville. So I would say the things that can set you apart would just be like, work experience, or like they like to ask about like experience with students or like teaching or volunteering. So anything like that, can set you apart other than just like your grades and your MCAT score.
piggybacking off of Abby, SI is like a huge one it's great in many aspects because you can pick a class that you want to teach that's on the MCAT. So you're basically studying and getting paid to do that and teaching other people. So that's one really easy route that you can take that kind of helps get you there. Also, any type of hands-on actually working somewhere. I worked as a scribe at Anderson Hospital for 2 years. After that, I actually became an MA, which is a medical assistant, and that is extremely useful. I already know how to numb up people before getting into medical school. I know how to room people. I know how charting works. And surprisingly, a lot of medical students that open up in the first year have no idea how to spell medical terms or what medical terms mean. And to just have that upper hand where you don't actually even have to learn what any of the words mean because you know what an appendectomy is, you know what a cholecystectomy is. So that helps as well, getting in work environment too.
I'll go. Yes, I'll go. I'll try and touch on things that nobody else has touched on yet. I would say for me, I've been doing research ever since I was like a freshman, and I would say that that was one of the things that came up over and over and over again when I was being interviewed. A lot of that though really depends on like the school and their mission and what type of like, I guess, candidate they're looking for. So if you're applying to like, if you're interested in doing academic medicine, then I would say it's very, very important to do research of some sort because almost all of like the high tier academic schools I applied to were interested in that. But on the flip side, I mean, on the flip side of that, if you're more interested in working in like primary care or just as like an on the ground position, I would say try and pick activities that show that you have an interest in doing that. So really, I think having an activity that you're passionate about that I guess works into what you would like to have out of a career is super important and will eventually come up in interviews.
Yeah, I think that's all really good advice. The one thing I will say is that, well, first, yeah, all of us did do SI. So small sample size, but 100% acceptance rate, pretty good. But I would say that clinical experience is definitely something that almost every school is going to want to see, just because it shows that you're interested in medicine, basically. But as far as one thing that makes you stand out, it's going to be, in all honesty, there's nothing that you could really do that a medical school is going to say, holy crap, I've never seen an applicant like you before. But that doesn't mean that what you're doing isn't important for you or important for the schools you're applying to. It's really important to pick something that you're genuinely interested in and that you can talk about it and you can say, hey, this is what I did and I really care about this. I would say that it's important to make sure you're not just getting invested in a bunch of different activities just to do it. Pick some stuff, pick a few things that you really enjoy and that mean a lot to you and run with that.
Yeah, I like echoing Grant, like I did not have really any clinical experience just because I worked in tutoring and that was something that was like, that was like my thing. And I don't think that like put me at a disadvantage at all. So if you don't have a chance to be a scribe or you don't have a chance to do all that stuff, like Grant said, just pick a few things that you're really interested in and you're passionate about, and that says so much more about you than doing like having 20 things on your application. Because people are going to have all this stuff on their application, but if you can like talk about a few that are super passionate to you and they can tell just from your personal statement or your application that you're passionate about those, then you'll be golden.
I'll add a little bit to that too. So much of it is selling yourself like as a candidate. And like she was saying, I don't know, it's incredibly important to pick things that you are actually passionate about and that reflect on what you'd like to do. So really, again, like if Grant had a really good point, there's probably not one single thing that you can do to really stand out. So you may as well just pick things that you enjoy doing and that look nice on an application, because that's probably that's the most honest way to apply, and schools appreciate that.
Also, I'm going to butt in one more time. I think I'm the only one here who took a gap year. So I feel like that's kind of a different aspect just on my end. Like I said, I did that a medical anatomy and physiology program. But prior to that, pre-COVID times, I actually was going to go to South Africa in a pediatric trauma unit and do some volunteer work. I wanted to travel anyway in my gap year. That didn't end up happening. But I think that would have been a really cool experience. And I had a lot of volunteer work in general. I don't know if any of you know, I did alternative spring break 2 out of the 3 possible years that I could have done it because I didn't know about it freshman year. But alternative spring break is such a great opportunity to go travel on your spring break, but you actually get to do volunteer work. And I don't think Jake is someone who can also speak on this. It is honestly life-changing. Like, and it gives you just an opportunity to just do volunteer work. And you can sometimes like you find a program, the honors one that we did, we went to 5 different locations. So you could kind of figure out what your niche was and where you thought like volunteering was the best. And I could speak about that trip for hours. So they could tell in my interviews that was something I was definitely passionate about. So that's also something you can do as well.
Yeah, it was a very fun trip, definitely, for sure. So for me, like looking back at the whole application process, really like when you're sitting down to write your essays and write your extracurricular experiences, it's all a reflective process. And so you really want to have some sense of keeping track of those experiences that are most meaningful to you. For me, it was the clubs I was in, the connections I had, and being able to talk to people or talk about those experiences is what helped me get an interview. And for everybody else, I mean, you have to apply. You have to have a good application. Your test scores don't matter to. I mean, you have to have good enough. Basically, you have to be good enough. I had decent scores. They weren't great, but I felt like my writing helped, and the experiences I had to share. Telling your story is kind of what I'm getting at. So, just find those experiences you can use to tell your story about why you want to be a doctor.
All right, cool. That really hyped me up, guys. Thank you. I'm so excited now. Our last prepared question before we go on to some questions you guys asked to Lydia is, what was your favorite extracurricular at SIUE? How did you help prepare you for medical school?
So I think I already talked about it a little bit, but I really enjoyed taking part in like research. I think that was one of like the most unique opportunities that I've been able to take part in. I've got to meet so many interesting people and travel and present things. And I think it's done a great job of like immersing me in science and helping me kind of understand and appreciate the process as a whole. I'd absolutely recommend if you aren't already getting involved in it, and most professors would really love to work with you. But yeah, that was probably my favorite.
Yeah, I would say I did research with Dr. Leslie Darren, and I didn't even really like research that much, but I really liked him, and he was an amazing mentor to me. So I thought that was great. I would say was one of my favorite things, just because I love like the teaching aspect and I love getting to interact with students. And like someone said earlier, SI also kind of prepares you for the MCAT if I taught a lot of like nursing chem and bacteriology. So that was pretty helpful for the MCAT too, which was nice. Oh, thanks, Justin.
For me, I tried research for 1 semester in organic chemistry, and I can say that bench research is not really my thing. It was definitely something that was beneficial to try. I would recommend that you at least think about trying it just because it is a good experience, but don't feel like you have to stick with it if you don't like it. But by far my favorite experience was SI. I love doing SI. I love teaching. And so that was just something that I was really passionate about and something that I stuck with.
Also to go off of that, I encourage you guys, if research in the biology department isn't what you want, or the chemistry department, it is okay to go do research in some other like different major or minor. I did psychology research, and my sister has autism, and there was actually one professor doing autism research. So that was extremely helpful for me. Like I got to know my sister better. Just it was a cognitive psychology, so it was decision making. But I got, I got to learn about that. It was something I'm passionate about, and I got to do the whole research thing. And because I was so passionate about, actually the first semester that I joined the research team, he made me the lab manager. So that was kind of cool as well. He kind of gave that to me because he could tell that I was, out of all of the people doing it, I was the one doing it because I wanted to, not because I had to. So that's, and again, as everyone's saying, SI is phenomenal as well. I think I was also a team leader for that. That looked really good. I think that, kind of with the last question made me stand out as well, that I was an SI team leader as well as just a leader. But definitely getting just something that you, like everyone has been saying, something you can talk about and they can tell that you're passionate about it. Because, if you're just checking boxes to check boxes, they know. They've heard it before. They've heard a spiel. They can read the room. They're picked for the admissions committee for a reason. So they know when you're just spewing bullshit versus actually caring about it. So pick something, no matter if it's, out there or not, in your major or minor, go for it. Do what you want to do so that you're passionate about something.
Yeah, I want to go off of that. Pretty much everyone does research that's applying to medical school. So if you don't want to do it, don't do it, and do something else that you really enjoy and that you're passionate about. Because yeah, it may look good, but it looks good on everyone else's applications too. So if you're going to do something that makes you stand out, like, you should be passionate about it, and you should not be, like Kayla said, don't just do it to like check it off the box.
For sure. Do something that's, you find pleasurable, whatever that is. I played racquetball with Grant a lot. That was an extracurricular I talked about in my application. Just kidding. I did ultimate frisbee. I thought that was pretty fun. I did write about that in my application. Yeah. So just whatever you find enjoyable. It's really what building your character. You're in college, so you're just do stuff that's you're going to be enjoy, and hopefully, yes, it's an added benefit if you can connect that to medical school and write about it, for sure.
All right. Okay. Well, that's all the prepared questions. I think Leah's going to ask the questions she got, but I mean, like I said before, like a lot of the principles and philosophies from like this club has really been based off like what I've learned from each of these panelists in the past. So I think I really bled through today. So yeah, it's great. It's great to see everyone again too. I miss y'all. Anyways, Lydia, let's get it away.
Okay, thank you guys so much. This has been really great so far. Sorry if my audio is a little gross. The first question that we have from people, which by the way, I'm really impressed with everybody. The questions were really great. So thank you so much for the people who sent me questions. So the first question is, I noticed that many of you have forensic science minors. What compelled you to choose that? And would you be interested in working in that field as a physician?
Yeah, so I have a forensic science minor, and honestly, I did it because I really like Criminal Minds, like CSI, that kind of stuff. And because if you major in bio, it's only 2 extra classes. It's only like an anthropology, forensic anthropology, I think, and a criminal justice class. So it's a pretty easy thing to add on to your degree, your application or whatever. I don't really see myself working in like forensic science or anything. But it's funny because in one of my interviews, one of the panelists did ask me about that. It was like, oh, do you want to go do like CSI work in your hometown or whatever? And we like just laughed it off. But yeah, I mean, it's something easy to add if you're like interested in that. But yeah, that's pretty much why I did it.
I also have a forensic science minor. Same with Abby. It's 2 extra classes. I actually kind of just wanted to expand my horizon. I thought I also watch Criminal Minds on repeat at my house for background noise. So I actually had a essay question for one of the medical schools that I applied to that asked like if I could not be in the medical field, like what would I do? And I actually did put like an FBI or CIA agent. I thought that was really cool. I kind of talked about one of the classes that I took for forensic was forensic biology. I took that class and it was with Dr. or Mr. Jennings. And he actually did a whole semester long where there was a crime and you had to solve it. But like you got like a budget and you had to, because in real life you have budgets, you can't buy every test in the book to figure out what's going on. So you had a budget and then you actually had to interpret all the data. He didn't just like give you the fingerprint analysis, like you had to put the fingerprint analysis together, or the blood spatter. You had to analyze that to see if it, they were hit or if they were stabbed, kind of thing. So that was a really interesting class that, it didn't feel like homework. It felt fun. And that was something I really liked. And also it was kind of a puzzle aspect. And that's what you're going to get as a physician. If you're especially like an ER doctor, someone's going to come in, they're going to have all these things. You have to investigate, you have to put the puzzle pieces together. So I feel like that gave me some critical thinking skills that related to biology as well.
I also had a forensic science minor. Mine was, at first it was just because it was a couple more classes, but forensic anthropology and then a criminal justice class, they were both really interesting and they were classes I otherwise wouldn't have taken. So kind of back to what we were all saying earlier about taking advantage of taking classes in your undergrad curriculum that you're not going to get to have before. I thought that was a good opportunity. Also, I mean, forensic science is just a really cool field and it's expanding a lot and they're using a lot of new techniques and things. So it was just interesting to learn about. And I did get asked about it in my one of my interviews as well. So it was just an interesting talking point to bring up. But.
So I dropped that fun fact in there. There's a field of medicine called forensic psychiatry. And I bring that up because the forensic science, of course, but also, so in the University of Illinois College of Medicine, there's these things called medical colloquia, and it's basically just presentations on different parts of medicine. Could be cultural, sociological, etc. And one was on Introduction to Forensic Psychiatry and Insanity. And I didn't go to that one, but it was offered today. I think it was all filled up, but something to look into, I guess.
Lydia, do you have the next question?
I think she's frozen.
Yeah, it's still a thing. Well, I mean, while Lydia's doing that, I guess I'll, yeah, I can share some funny facts about the panelists that I know of, or Lydia, you can talk now.
Okay, I'm back. Sorry about that. It keeps kicking me out for some reason. The internet is not my friend today. I'm so sorry. Okay, the next question is, thank you, by the way, for your responses. I really appreciate that, and I appreciate your patience. The next question is, what does the first year of medical school look like? You don't have to get into the nitty-gritty details. I'm sure you don't want to talk about it that much, but if you just want to, like, you know, give an overview and like what somebody should expect.
Yeah, so honestly, it's just a lot of science classes. It differs on your school, but usually the first 1.5, 2 years of medical school are pretty like book heavy. So like our first semester was a lot of biochem, immunology, micro, a little bit of cell. And then like our second block, which started in January, we started getting into systems based. So we did like musculoskeletal system, cardio. We're doing cardio and pulm right now. And then the rest we'll do systems based until next year this time, and then we take our first board exam. So basically just a lot of like basic science classes and then systems based learning.
Well, since Jake and Abby are both at U of I, I'm guessing they have a very similar response. So I'll go ahead and add that it's kind of dependent on the school, but for the most part, your first year is going to be basic science, like Abby was just saying. For us, our first semester was all clinical anatomy, and then the second semester is cellular stuff. So biochem, immunology, histology, genetics, a bunch of things that are cell related. And then second year is mostly physiology here. But again, that's going to depend on the school. But your first 2 years are basically all didactic or book learning. And then your third and fourth are rotations.
Like I said, I'm not technically in medical school yet, but I did the MAP program. SLU's medical school was actually, they started off system based, and you started with embryology, histology, physiology, neuroscience, and then gross anatomy is their full curriculum for that first semester. And they did system from the very beginning. So all your histology and physiology was all interrelated. So we would go, you know, the heart and cardio, like cardiopulmonary, like Abby said, and then we'd move on to a different system, and then we do like renal, but all the classes kind of followed the same pattern. But yeah, like everyone's been saying, every kind of medical school is different. I interviewed at UMKC, and they do rotations the second week of school. So they start the rotations week 2, and you have it every single week until you graduate. So that was something different about them that I really liked too. But yeah, so every kind of school is different. It's just basically systems, not systems, and then kind of when you start your rotations.
Yeah, I can add. So my boyfriend Jackson goes to UW-Madison, and he's in his first year too. And they basically do the same. They're systems based from the beginning, but they're also in clinic once a week, just shadowing with like a family med doc. And then they incorporate clinical skills in there too. And at U of I, we do clinical skills from the beginning. You like start off learning how to take a history, and then once you get into systems based, you learn those physical exams. So like we're in cardio right now, and we're learning how to do the cardio physical exam. So it all just kind of goes together like that.
It's a lot of studying. A lot of sitting in this chair and being on my laptop like 8 hours a day, but I love it. It's, you know, I don't see myself doing anything other than that, but it's definitely enjoyable. It's a lot of learning, but it's definitely fun.
Definitely have to be dedicated and enjoy what you're learning, or else it's going to be a little bit miserable. So that's why it's important to figure out if this path is right for you.
Well, on that point, actually, I'm trying to get through as many questions as possible. So if I cut you off, I'm sorry. But this kind of goes with that question. I'm skipping around. So if you're like, hey, I sent my question a lot earlier, that's why I will get to it. I'm trying. Somebody asked, what was a discouraging experience that you went through on your path to medicine? And like, how did you recover from that experience?
Mine was definitely taking the gap year. It's really hard to make that decision. It's really hard to tell all your friends and family because they're always like, "Oh, why are you doing that?" You know, I also come from a family. I was the first to ever graduate college, so they have no idea like medical anything. So you know, explaining it's okay to take a gap year if you guys are overwhelmed and you're like completely overwhelmed, you know you're overwhelmed and you're signing up for the MCAT and you know you're not going to do your best, take a gap year instead. Like I messed up. I took the MCAT when I knew I wasn't prepared for it. So I had to take it twice and take it once so you don't waste many more months of your life and have to sit through a 7-hour exam twice. But that was pretty discouraging. But knowing, I think if I would have went into medicine the first time that I applied, I would not be who I am today. And I think that was a lot. I got so much more. Like I said, I work as a dermatology MA and I scrub in on surgery. I got so much more experience that way. And being able to take time and breathe before you go into medical school, like that's totally fine. And that doesn't work for everybody, but I think that a lot of people, you know, are so scared to take that jump of, you know, and with Abby who changed her major, you know, just trying to figure out the non-traditional route. That's okay to take that time and like take a gap year or two. When I interviewed at UMKC, one of the students on the panel, she was 56 and she was in her third year of medical school. So, you know, she said she ended up finding out she got cancer and then it was cured and she decided that she wanted to be the person that helped her. So it's okay to be non-traditional. So kind of my 2 cents.
Yeah, honestly, the majority of people in my class, like I think I'm in the minority going like straight from college. I would say the majority of people in my class and like in other classes I know are like 26, 27. So they've taken multiple gap years. They did grad programs. So yeah, gap years, that's like the normal now. So if you want to do that and you want to go do something else, like there's no problem with that.
Yeah. There's one guy in our class who's 51 now, and he's a first year. So it's really never too late if you decide, and obviously you guys are all in college, so you're not like 51, but most of the people in our class, I think muted myself, on average, our average person is like 25. So like Abby was saying, it's not unusual for the class to be full of people that took gap years. Like that's totally fine. For me, the most discouraging thing was just trying to find the right kind of information when applying. Cause I mean, if you look online, there's a lot of not great information. There's a lot of sites and resources you're going to see that are saying like, if you don't have 99th percentile GPA and MCAT, you'll never get in anywhere. Or that you need like 30,000 hours of volunteering or a school won't look at you. And so it's just really important to figure out what is information that's actually helpful or information that people are just putting online because there's no checks on what they can actually put there. And so hopefully what we're providing for y'all is some good information for people that are actually in or accepted to medical school. And so you can kind of see our experiences in that you don't have to be like the best of the best to get into med school. So
Oh, no, I can definitely, that was actually going to be my answer as well. Grant makes a really good point that it gets very easy when you're like researching, and you guys are all very driven people. So I'm sure that you're the type that are going to go look up like, what should I be doing? And like, where should I be at? So I think an important thing to kind of keep in mind is that you can only be the best version of yourself, and comparing yourself to what other people have had the opportunity to do is kind of self-destructive. So rather than focusing on, okay, this person has all of this and I only have this, you should focus on what can I do to make myself better today. But I mean, a little bit of a cliche answer, but it's very easy to fall down that rabbit hole.
Yeah, I would say SIUE does not, like, when we were going through the process, they did not have, like, we didn't have this. We didn't have like a like med, like faculty committee to help us. Our advisors were useless for medical school. So I felt like I was really in it on my own. Luckily, I had a few classmates, like my close friends that were going through it with me. So that was the most discouraging thing, was I felt like I was going in this blind, and like I didn't know when to submit, I didn't know when to do anything. So take advantage of like us here today. Like, I'm sure we'll all give you our emails. I think like the best people to give advice are the people who are like in it and have gone through it, and who can help you. The internet is like a great thing, but it can also be super dangerous. Like it can be hard to find information that's like actually accurate. So yeah, I would say SIUE doesn't have the best preparing for medical school like that wise, but like we're all here to help. So
Make sure that you're, just to add, make sure that you're taking control of your application, and like you're researching things out for yourself, taking in other opinions and other people's experiences as well. But make sure that, like, if you have a bad experience with an advisor, because that's something that like everybody will talk about, having a bad experience with their pre-med advisor at some point. Just remember that you're the one that's in control of how your application is going to be, and you're the one that actually submits it. So just take the reins on your adventure. As stupid as that just sounded, but
I also think it's important to note that like applying to medical school is not a sprint, it is a marathon. So don't assume that you're going to get all of this stuff done in like one weekend, or, push it off, or, I would say people who are going into medicine, we're pretty elite students as is, and some of us push the boundaries of procrastination. And this is not something that you want to do on that. We already kind of talked about, applying early. But actually physically making yourself sit down and write, well, if you guys don't know, when you're applying, you have to put in manually every class you've ever taken. That sucks. It's the easiest thing, but you're sitting there entering like 60, 70 classes, and you're just sitting there and you're like, oh my God, this is the worst thing I've ever done. And that's technically the easy part of the application. Then you have to write your personal statement, and then you have to write all your essays and work, and you have to get your letters of recon. So it is a marathon, not a sprint. Don't go into that thinking you're just going to get it, quick. And I feel like that's not explained a lot to pre-med students, is the application cycle is a long and hard one. The MCAT isn't the biggest bump to get over. It's getting over I think the work and activities is the worst part of the application, if I do say so myself. I don't know how you guys agree, but that's pretty bad. You have to sum up all of the things you've done into little tiny paragraphs. So yeah.
yeah, the application is definitely, it's long and drawn out for a reason. It's kind of it's one of the many things with applying to medical school where they're trying to sift out people that don't really care that much. And there's going to be people that like see how long that application is, and they're going to be like, nah, never mind. And so it helps to kind of like, I guess, get rid of those kind of people. But yeah, I mean, like Kayla was just saying, that the activities section it takes some time, and it's important to start like when that application opens up, be thinking, well, actually, okay, let me stop. Ahead of time, be thinking about what you want to talk about with your activities. And then when that opens up, just try to explain it to the best of your ability, and have other people read it so that they can look over and see if there's ways that you can reword stuff. Get as many eyes on it as you can.
All right, guys, thank you so much. That was great advice. We only have a couple minutes left, and I want to make sure we get to as many as possible. So just one more question, I think will do us. I mean, I feel like you guys touched on a few of these. Another one was like, what do you do in an interview if they ask about like your MCAT score and it's like not as good as you wanted it to be? Or like, what if you go into an interview and you don't have a lot of clinical experience and they ask you why you don't? Kind of more specific questions like that.
I mean, I can kind of speak on this. The MCAT, some people are just good test takers and some people aren't. That's just kind of how the cookie crumbles, and no one gets the same MCAT. No one gets, close to no one gets the same questions or anything either. So you may have known 10 of the questions on someone else's exam and not known the 10 questions that were on your exam, and that sucks. So I think a big thing, I actually didn't even get asked why I took the MCAT twice. So I feel like that's surprising that none of my interviewers like asked me any of those questions about it. I think at this point they kind of know. And at this point, the interviewers know that, the average age is like 26 or 25. I think nationally it's 26. So yeah, say, and we take exams on different days and the different days are different exams. So you can't even compare to other people. And I think it's kind of explaining that I think when you have a good academic history and a not so great MCAT score, that kind of lets them know, like a little personal. I took it twice, both of my scores were okay. They're not where I wanted them to be, but I don't think anyone's MCAT score is where they want them to be. But my academic was so high that it kind of balanced out, that they could see that, actually in the field, I can get things done, even though my, standardized test wasn't as perfect as it could be. So.
Yeah. I think they did ask me something about clinical experience, and I didn't have very much. So I just talked about how I did a lot of tutoring, and that was like what I was really into basically. And then that like sparked a conversation about that. I was happy with my MCAT, but they did ask me like how I studied for it, which I thought was kind of an interesting question. But yeah, that's all they asked me about that. But I mean, if they do ask you, just be prepared. I mean, these are the type of questions you'll prepare for before you go in. Just be truthful with them. Like interviewers, they're trained, they can see, they can see when you're not being truthful. So just be honest and they'll really appreciate that.
I was going to say, so kind of jumping off of that, I would say that if you are asked about something and you don't have it, one of the worst things you can do is like lie or double down. Your best bet is usually to just lean into it, and it's an opportunity for you to explain. Oh shit. Yeah, no, it's an opportunity for you to explain away why you didn't like have something, and if you can think of a good reason as to why you don't, I think that's much better than trying to lie or cover up or direct away from it. I think owning what you don't have is just as important as like flaunting what you do.
Also, side note, not all interviews are personal questions. UMKC was strictly all MMI, and I don't know if you know what that is, but it's basically they give you a situation, you explain what you do in that situation. So UMKC was 12 MMI questions, and they asked me nothing about myself. So there are different types of interviews, so they're not all going to be as personal. SIU is like extremely personal and really chill and down to earth. I think everyone can speak on that who interviewed there. But yeah, UMKC was a big just MMI. There was no personal questions involved. So.
Yeah, when you're interviewing, definitely don't lie, because if you start making up stuff, you're inevitably going to mess up, and then they're gonna know, and then there's no way you're getting in. And also integrity, so don't lie. But basically, if they ask you about something that you like, I didn't have very much clinical experience, honestly, and it never came up. But it's important that if people do ask you questions like that, have a reason as to why. So like Abby was saying, being involved in tutoring and a bunch of other activities took up a lot of time, and that was kind of the case with me too. And so if they ask you about MCAT scores and it's not as high as you may want, I mean, just own it and talk, and then kind of get around that and talk about things that you're passionate about. Don't obsess over a couple things that are missing from your application necessarily, because everybody has some stuff like that. Just own who you are and what your application is like. And that's the best advice I can give there.
It's like, definitely agree with you, Grant. With the MCAT questions I was asked too, and they're like, it's mostly your reasoning for, how you performed. Whatever your answer is, that's what they're kind of assessing, I would imagine. Because you have an interview, you're already there. I mean, it didn't hold you back, so it's not really something of concern. So I wouldn't dwell on that.
Yeah, kind of piggybacking off of that, an excellent piece of advice that I got when I was interviewing is that you're being interviewed for a reason. They are interested in you to some capacity. So I guess, just kind of general interview tips is that, you got to understand that you have some power, because just as much as you need to go to medical school, they need medical students and they have selected you. So don't like grovel and I do your best to represent yourself fairly and honestly. And I think that you shouldn't have any problem in an interview.
I think also the biggest thing too is we're not used to selling ourselves like that. Take every little thing you possibly can and use that to your advantage. It's okay to use that. One of the biggest things I researched is the disadvantage status on your MCAT. I actually did mark myself as disadvantaged on a socioeconomic standpoint. And it's actually not bad at all to mark yourself disadvantaged unless you have a shitty reason for it. If you can spin something to make it disadvantage, perfect. That works for you. It doesn't matter what type of the disadvantaged or how disadvantaged you are, just as long as you have a good explanation as to why. So that's also something to think of. You need to be able to sell yourself too. It feels weird. I struggle with that a lot, where I didn't want to seem braggy, but this is the time to be the most braggy about yourself as you possibly can. This is when it means the most. So
Authentic. I wouldn't say braggy, but it could apply like I view myself as a team player, and that's all you write about. You're using those words, but definitely tell the truth and be, authentic with your explanation. I definitely agree.
Okay. All right. Awesome. Thank you guys so much. This has been so much fun. I feel like everybody's really learned a lot. I've gotten some good comments in the chat as well. I think we're gonna go ahead and finish up there. Thank you again. Thank you to all our panelists. We really appreciate it. You guys taking time out of your busy schedules, especially like right now. Justin doesn't want you to go apparently. You guys can stay and talk to Justin if you want. Oh, you're welcome, Grant. Sorry, I had to change my name. I forgot about that. So thank you guys so much for putting up with technical difficulties on my end. And thank you guys for making this successful. To the participants, go ahead and give us some feedback, like, the members of your executive committee. So go ahead and give us some feedback on this event too, if you want us to have ones like this for, other specialties and things like that, because we can definitely plan those going forward. So if you liked it, let us know and we'll prioritize it. Sorry, executive board. I don't know what to call it. Anyway, so I hope everybody has a really great weekend. Thank you again. Yeah, and have a good night too. All right, I'll talk to you guys later. Yes. And check the chat for emails too, because a lot of panelists put their emails in there if you guys have questions.
Yeah, I love to answer questions because then I don't have to study because I'm always on my computer anyway. So always free for that.
What's happening on March 31st, Grant?
March 31st.
I'll be on campus is what he's talking about.
I think my break's around that time. Is that right, Abby? Is our break around then?
No, ours is the end of April.
Oh.
Yeah, we still have like 5 more weeks of cardio poems. So.
It's all right. We get like 2 weeks. So I guess it's like a 2-week break. like a week to study, which is nice about our school. We have
Wait, we
like a
get
full week,
oh yeah.
like on our exam weeks.
Yeah,
to,
we
like,
do.
learn.
We get like 4 days or something.
Yeah, it's actually pretty helpful. Any other questions, or are y'all done? Is that it? I'm free to chat.
Lydia.
I mean, there are a few more. I'll send them in the chat. I actually have to go to another meeting, so I apologize, but I will send the whole list of questions that I got in the chat before I leave. So if you guys like want to stick around and talk, you totally can. This Zoom meeting was technically scheduled for 2 hours, so you guys have it until 6. So I'll go ahead and put those in the group chat. And if you ask one of these questions that didn't get answered and you want to stay and listen to it, then be my guest. Justin, you're an alternative host, so if you stay, I think we should be okay. Okay, have fun, everyone. Thank you guys for your patience. I'll talk to you guys later. There's the questions. Okay, bye.
Is there anyone still here whose questions on the chat? So we can go with those first until the people who actually left. So I know Addie, Mackenzie, you had one. Stephanie, you guys had Alexandria. If any of your questions are on the chat, tell me, and we can go to those ones first. Well, my voice got really low all of a sudden. I don't know where that came
I
from.
was just gonna ask. Oh, did I interrupt you?
No, go ahead, everyone.
Yeah, I was gonna ask, like, can you guys say the professors that you did research with and why you did it with them and how your experience was with that?
I worked with Dr. DeSalvo in the biology department. She is the sweetest human being alive. Excellent person to work with. Super friendly. She works with like symbiosis. So if you're interested in like bacteria and how those are going to interact with like eukaryotes, she does lots of like molecular biology type stuff as well now. So if you're at all interested about any of that, feel free to reach out.
Yeah, I worked with Dr. Darren Lessie in Cell and Molec. And he's just like, if you've ever had class with him, he's just like an all-around amazing guy. He's super supportive, super nice, just like very chill, but he really knows his stuff too. So he does, I think my work was in like recombinant DNA stuff. And I like was not that good at research, but like with him I was, because he was super helpful, and like I got to go to conferences and like I placed at one of them, so he must be doing something right and I must be doing something right. But yeah, he was a really cool guy, so I would definitely recommend working with him.
I worked with Dr. Jonathan Pettibone in the psychology department. He's a cognitive psych professor. He's a very cut and dry type of person, but he answers questions and he tries, if you seem interested, he'll go in depth with you and sit down and talk to you. He doesn't kind of just like brush you off and leave you to your own devices. I also worked with Dr. Paul Brunko as well for my senior biology class. And his is really cool if you kind of want more animals. We did ants, but he has a snail lab as well. And I think a fish one too. But he's really funny. He's really out there. If you've ever met him, you know exactly what I'm talking about. But if you're thinking more like animal based, he's definitely the one to go to too.
I didn't do any bio research. Oh, sorry, Grant.
No, go ahead, Jake.
I did research I was an IRCA assistant, and I worked in the philosophy department. So I did a research project with Dr. Reiheld. Just more of a interviewing. She did the interviewing, and then I helped transcribe the interview. And we actually ended up presenting at a conference in Pittsburgh during my senior year. And that was really cool. It was an ethics, bioethics conference.
As I mentioned before, I did research. I worked in Dr. Yun Lu's lab. He's an organic chemistry professor. And we did things with hydride reductions. So I don't know if any of you are in organic right now, but hydride reductions and the concept of hydrogen tunneling. And so if that sounds remotely interesting to you, I think he's still doing it. But it was an experience.
Again, see, Stephanie, do you have any questions before I go on to the ones on the chat? Okay, just a second. Alexandria messaged me. She said, what did she say? She said, my question was the one about what to do if you don't get an interview or a good MCAT score.
What do you mean by good? So good MCAT score.
Yeah,
That's a whole thing we could talk about.
Did you put in the chat what you mean, Alexandria?
I mean, yeah. Well, I mean, there's, I guess, an objective way to look at it too, but I don't know. I don't like the MCAT. I think it's just a roadblock in the way.
The easiest thing, I mean, if you don't get an MCAT score that you want, take a step back and think like, okay, is this something that's not going to be competitive to programs that I want to apply to? And if so, take it again, study again, figure out what didn't go well the first time and sign up for it again. And don't be afraid to have to take a gap year. Like Kayla was saying, there's nothing wrong with doing that. Most people are doing that at this point. So yeah, if you don't get the MCAT score you want, it's really not that big of a deal. It's going to cost you some more money. But other than that, I mean, you just sit for it again and figure out how to improve. And that's kind of the same thing. If you don't get any interviews, have some people comb over your application, talk with some people that you know that got in and have them potentially look at it. Think about what might have been lacking on your application that you think you could improve, whether that be a GPA or MCAT or anything like that. And you can even ask schools for feedback. If you do get an interview and don't get in, I think they're more receptive to giving feedback than if you don't get an interview, because they honestly, they don't give interviews to so many people that apply that there's no way they could give feedback to everybody. But if you do happen to get an interview and don't get in, schools will sometimes be able to give you some feedback.
I think it's also important to like evaluate why you think you didn't get in. If you're applying out of state, that's a huge one. There's so much in-state bias to when you're applying to medical school. It's kind of hard to get out of the state that you live in or, surrounding ones. UMKC, I was actually waitlisted there. I did not get in, but their acceptance rate for out-of-state students, they didn't accept anything that didn't touch Missouri, for one. For two, the only out-of-state acceptance rate that they had was 0.01%. So I knew applying there, I wasn't necessarily even close to getting in. Even being waitlisted, I was super happy about it, even though it wasn't the outcome that I eventually wanted. But yeah, taking a step back and evaluating what factors you think led to the reason why you didn't get an interview or didn't get in is really important too. Because like I said, the out-of-state bias is one of the most horrible things that exists. Because I want to go south where it is nice and warm, but I didn't think that was going to happen. So that's one big thing too.
I'm sorry. Do you want to go ahead?
You can go.
Okay, I would say so much of like Grant was saying in the chat, your school list really is like a massive influence on how much success you're going to have applying. So I encourage you all to actually do your research before you pay the money to apply to a lot of these places. I probably wasted a good $500-ish applying to places that I had no business applying to. More so for like in-state, out-of-state bias or not being like a good fit for their mission. So it's well worth your time. I mean, think of it like a job to do your research before you submit it, because you are paying for these things. But no, I would say applying realistically is really, really important and is probably one of the biggest influences on what types of places you're going to interview at.
Yeah, and also if you don't have the MCAT score you wanted, you don't think you're competitive for MD, you can always apply DO. It's a different pathway to get the same result. I have like friends that went DO and they matched like better than people I know with MD. So if you're not competitive for MD, and if you don't want to take the gap year and you don't want to, you take some time off, like you should try DO. It's the same thing. You're going to end up doing the same thing. DOs and MDs go through the same match program to get into the same residencies. So you end up at the same place no matter what. So that's another option as well.
And I'm reading a comment here.
Also, though, one thing with DO, correct me if I'm wrong, guys, isn't it that you might not get to do specialties as much, right? Like surgical specialties is hard to do for DO, I think.
I was saying, I was reading the match threads online today. There's definitely a bias against, like, if you're doing anything competitive, there's still like an MD bias. But if you're interested in like primary, I mean, and I wouldn't say that it's significant or that it's impossible to get in with a DO, but like by the numbers, there's a little bit of a bias towards an MD. So if you're looking at doing something really competitive, you might consider where, like, and how you're applying.
Yeah, because I was thinking more on like
Yeah.
specialty surgery might be kind of something that I'd want to do. So I knew DO, it's kind of hard, I think general surgery is pretty equal playing field, but I think anything else like specialty wise surgery is kind of the MD, like Andrew said, kind of has the upper hand there. So that's just something, it's not super important, obviously, but that is one little thing to consider between the two programs.
It's definitely multifaceted, but there is no specialty that DOs are like not allowed in. And with the merging of the residencies where MDs and DOs, the residency match process is merged now. You still can match in anything. It is statistically much more unlikely to match as a DO. And a lot of that comes down to the fact that DO schools aren't set up at academic medical centers. And so like where you go to school sets up like a handful of residency spots for students at that school. And so that it makes it a little bit harder. But I wouldn't, what specialty you want to do isn't necessarily a great deterrent from DO. It's just something to consider because it is going to be much less likely, at least as of now.
Yeah, I'd definitely look into like people that are in the specialty and see what potential bias, if any, really, if towards DOs or not. You could do that by reaching out. I mean, I listen to the Specialty Stories podcast, and that's through a doctor that's an MD, but talks with other specialists and specifically asks that question if DO is a bias. And most of the times, I've never really heard that there's really a bias from those specialists and those physicians. But it is a different path. I mean, you are going to be a doctor at the end, but it's you do have to take different exams within the school, like the COMLEX is one, and then other people, they'll end up taking the USMLE on top of that COMLEX test. So it's just a different route. But there's a lot of different schools that are in the area. If you're interested in going to out west or something, there's more DO schools out there. I don't think there are really any in Illinois in this area as much. At the end of the day, you'll be a doctor, I guess.
And that's kind of something, when I was applying to as well. Yes, your medical school matters. That's not what I'm debating here, but which medical school, not necessarily. You're going to be a doctor at the end of the day. People have dreams of Ivy Leagues and stuff. Just because they're Ivy Leagues doesn't really mean that much. SLU actually almost lost their credentials for their medical school a couple years back, but there's still $57,000 a year to attend to. And that's just not for me. That was one reason why I didn't apply there. I did, their grad program, nothing bad about the medical school, but that's still something to consider. Don't push away what quote unquote lower end schools just because you think that there's some stigma around it. Medical school is medical school. You will be a doctor by the end of the day. So just think about that too. The name isn't everything.
Just little letters.
Yeah, and medical school honestly is a lot of like teaching yourself things and using outside resources as well. Like I know some people in my like some M3 and M4s who like don't even go to lecture. They just use the outside resources to prepare for STEP, which is like the board exam. So if you are good at doing on your own, like you can literally go anywhere and score well. Like it's all just up to you, and like the school will give you the resources, but you have to like push yourself to use them. And if you want to use outside resources as well.
All right. Addison just put something in the chat. She asked, would you want to have letters of recommendations from a slight mix of people, for example, professors, employers, if you work in a clinical setting, etc.?
Yeah, I'd say get letters from people that know you best, and that of course meet the requirements of the schools. So what I did was look into the schools that are applying to and see what kind of letters they have. And most of them, you have to have a professor. I didn't have a science faculty member write any of my letters, and I didn't apply to schools that required science faculty. I just didn't connect with any during my pre-med years, and so I was like, why have someone write something that doesn't really know me? And so I had letters from a couple professors, and then a personal letter from like a instructor that I did. It wasn't through a university, but so stuff like that.
Also, to kind of piggyback off that and kind of going back to what we talked about before, I had Rhonda, which is the SI leader, write one of my letters of rec, because Rhonda is one of the sweetest human beings I've ever met in my entire life, and I don't think she could say a bad word about anyone. But two, also because she knew me so well, she saw my work ethic, she saw my SI students. I know she was retired. That's so sad. It hurt my soul when I found that out. But if you did get the chance to meet her, she is a ray of sunshine. But having someone write a letter of rec that isn't just a professor is also really helpful. I actually even me and Rhonda pieced out at the same time. But I also had some of the doctors I worked with as a scribe write me a letter of rec, and I feel like that is a very valuable, because you're having someone who is a doctor write about how you should be a doctor. So, their opinion is obviously going to be weighted really well with the academic, the admissions committee too. So SI is just going to be crazy, and seeing all these men, so sad. The whole team's gone.
I would say look at the schools because they all have different requirements, but usually they want at least one science or one non-science professor, maybe like an employer or like an advisor, some mix of that. It all changes. Usually it's like anywhere from like 3 to 5 letters. And then like you can choose which ones you want to send to what schools. So definitely just look into that when you're researching schools.
I would say I guess kind of along a similar vein, when you're applying, you're kind of telling a story about yourself. Like when you write this personal statement, you're telling a story about like, why do you want to be a doctor? And so I found personally that if you can find people that write strong letters that support your reasons for wanting to be a doctor, that only increases the quality of them. So for me, wanting to work in a rural community was important to me. So I tailored like a lot of like the letters that I was asking for towards that. And I think that I had good success at like those schools that I was interested in as a result. So really, I guess, consider what you want out of your medical school education and try and tailor your approach to like letters and applying in general towards that.
All right.
Thank you.
Bye,
Yeah,
guys.
thanks for coming.
This is just, yeah. Okay. I think this is a good note to end on. I'm gonna say one more thing though. I just made a presidential decision like 30 minutes ago. Now I'm on Instagram for P-Hub. Oh, Pre-Health Hub. Sorry. We call it P-Hub because it's funny. For Pre-Health Hub. Kayla, I see you. Okay, anyways, for Pre-Health Hub, I have a recording too, but I want each of you guys to have maybe like put a sentence as in a sentence, give you like the best thing you can do, like your best advice, the best thing you can do during undergrad to really like help you as a pre-health student. So it doesn't have to be pre-med in general. Jake, it doesn't have to be pre-med. It can be general, but like pretty much, I'm gonna put a prompt on the chat before I forget. But what is the best advice such thing you can do as a pre-health student at SIUE? And then I'll make Lydia, because I don't know how to do any of that stuff. I have a photo of you guys with the quote. So, yes. Yeah. It might be it's a long-winded question, so I think we have 13 minutes, so that's good enough.
Do you want us to like type out our answer real quick, or would it, because that way you can have it, I mean, saved, or do you want us to like just wing it?
Either way is fine. I have a recording. I'm recording
Gotcha.
this.
Okay. I'll save you a step. I'll save you a step.
Okay. I'm gonna say reach out to your professors, or interact with your faculty and get to know them, because they're people that can really lead you down different paths, and even write you a letter. Maybe.
I think being present is something that's overlooked a lot. Make sure that you're actually enjoying what you're doing right now. Like I said, don't be the person that checks off boxes just to check off boxes. Like actually thoroughly enjoy and be in the moment. You might be learning something that's not your favorite thing to learn, but take that and figure out a way that you can twist it into something that you enjoy. Or like Cell Molecular was probably one of my least favorite classes, just because that's not stuff that interests me. But I took that as a learning lesson. I learned it was my first flip class in college. So I kind of learned how to study on my own, which is a lot of medical school stuff. So even though I didn't enjoy the material, I took away a good life lesson. So just be present, all the things that you do, and do them with a passion.
Yeah, I would say just get involved in like activities, hobbies, interests, whatever that you're really passionate about, not just like the typical like, I don't know, research or like being part of like a like obviously pre-med like helps, like a pre-med club helps, but just doing things that you're interested in that make you stand out, that help people like see who you are as a person. And I feel like no matter whether you're doing like medical school or any other grad program, like those things can make you stand out and make you, a good applicant for that. And they allow you to have some fun while you're in college as well.
I would say that sorry, Andrew. My biggest piece of advice is just to explore what your interests are. Take the time to figure out in college what you really want to do, and don't feel like you need to have a complete understanding your freshman year of what you want to do when you graduate. Be open to changes, be open to different opportunities.
Snag that right out from under me. I was gonna say it's important to explore interests of yours, like regardless of whether or not they're related to medicine, because these interests are what's going to help you eventually connect with patients and socialize with people. And so much of medicine, I mean, there's more to medicine than just biology and memorizing and knowing facts. It's about working with and connecting with people, and understanding yourself helps you better like connect with others. So.
This is totally a side note, but also like doctors also had to be able to handle social situations. So yeah, you might be that 99th percentile MCAT and you might be 4.0 GPA and you've taken every hard class that you possibly can. But if you have shitty social skills, you're not going to get very far as a doctor. So keep that in mind too. They look for that in admissions, are you personable? That is, so again, that comes back to the whole being authentically you. They can tell when you're either, just kind of bullshitting them, telling them things just to make yourself sound better. So yeah, think about that as well. It is not just the academics that they're looking for in people too.
All right. I got that all down. Thank you. Also, I'll relook at this thing as well. All right. One more thing. I'm going to take a screenshot of the chat or of us for the P Hub. So if everyone, you can turn off your camera if you want, Ireland. So if everyone wants to smile for a photo, we'll do this. Okay. 3, 2, 1.
You're smiling.
Yeah, I got it. All right. Cool. Thank you guys, everybody. That's all I had. I guess everyone's has Zoom fatigue now too, but I really do appreciate it. Being back here again. Always, I miss all you guys too. Actually, Andrew's still here. I don't know why I just keep saying that. But yeah, we're good. Thank you guys for coming.
It was nice meeting y'all too. For those of you who I haven't met, it's nice meeting y'all.
Yeah,
Yeah, good luck with everything too, Andrew. With your studies and everybody
So
else.
much.
Yeah. Bye.
This is a lady.
No one wants to leave.